A really good metaphor for the transition process is like being on the edge of a canyon and you've got to cross a bridge, but the bridge is out and you've got to get down that canyon and get up on the other side. Everybody gives you the tools that you need, but you've got to get down that canyon and up the other side completely on your own, and there's nobody, exactly waiting for you on the other side.
Children's Hospital did such an excellent job of taking care of everything. You suddenly say, well, what happens now? So there was the matter of equipment replacements, there was a matter of lining up doctors. Who do we rely on now that the Children's Hospital is in our past?
At the time of transition, one of the big benefits that you lose is the shift from pediatric to the adult world, and there's a full year where you don't have any funding for any equipment.
It's leaving that wonderful warm cocoon where all your appointments were set up. You had a history with your doctors. We were now going to be going to unknowns, doctors we had no history with, doctors we didn't know. Michael was going to be making his own appointments.
It's, again, very easy to panic and be alarmed by the whole situation, and wondering if you're going to have to explain your whole medical history again to a whole new person. So I can see how it can very easily become this big, scary thing, because it is. Even when I had a good experience, I can still say it was still kind of an overall scary process.
Things do build up, and you do think, oh, I've got the weight of the world on my shoulders. How are we going to manage? And I think if you can just grasp onto the positive and think of the good and the fun and the things you can do, and I think that will get you through.
I felt like I had fully transitioned into the adult world when I finally actually met face-to-face with my specialists and saw them, and after having the meetings and sitting down and talking with them, I really felt like that was it. That was where things were going to go and how things were going to be, and that I'd actually had made it to that point.